Initially, reports were that the virus was probably as contagious as the flu. And initially, there were also reports that the virus can also be transmitted even in the absence of symptoms. And some of these theories have been debunked. So I would say that it's contagious enough to the point where there's person-to-person transmission in multiple parts of the world currently. But I would say that it's not settled yet, because until you see the whole outbreak and the progression, you won't be able to assess this accurately. Respiratory virus infections cause a syndrome, and a syndrome typically involves many signs and symptoms, including fever, including coughing, including head congestion. And to be honest, it's very difficult to really distinguish flu versus RSV versus parainfluenza versus coronavirus. Obviously, you don't want to test everybody in the world with cold-like symptoms or flu-like symptoms, but this is where the epidemiology, that is the demographics of where the patient comes from or where the patient's been, is really important, and also about the timing of the return for that person. Folks who have concerns about having had the infection, the first question that they need to ask is whether they've really been to an area where we know there's been virus transmission. But if you haven't really been to any of those destinations, or you haven't been in contact with anybody with known coronavirus infection, then what I would say is that your risk here would be very, very low currently in the United States. The key intervention in infection prevention is hand hygiene. And one can perform hand hygiene by different methods. An on-the-go method would be to grab a sanitizer, like alcohol gel. I would say that it's always important to have also the opposite side of the prevention equation, which is if you're sick, you want to avoid contact with folks. You want to avoid sneezing, and you want to wash your hands also, because the way you acquire respiratory virus typically is by droplets, and also by surfaces, by touching surfaces that may have the virus. And sometimes viruses can linger quite a while, especially if the surface is wet. If you think you are ill, and you may have a contagious infection like a respiratory illness, it's always important to give the clinic or the ER or the hospital a heads up, saying, these are my symptoms. There are mechanisms through which we can actually send a team to test you at home, for instance, or it could be a clinic. But the main intervention here is that give us a heads up, and then we can help you assess your risk and then see what the next steps are. Usually what you see on the street is that folks use a mask, then pull it out, and then use the same one, then it's kind of hanging out. So the mask is not really functioning effectively. A mask is not good if you're not washing your hands. A mask is not good if you've not fit it correctly. It needs to be tested. So I would say that for the general population, masks is not where we should focus our prevention efforts. It's really going back to hand hygiene. One part of the decision has to do with really checking with CDC. CDC has a website where you have the travel advisory. And for instance, going to China is not recommended today, for instance. And I think that list will continue to evolve. So it's really good to go to that website and get that information. But also I think there's going to be a component of this that's going to be a personal choice. At UW Medicine, we've been very lucky to have strong partnerships with Seattle, King County Public Health, Department of Health, and CDC. This has been vital to our preparedness and overall efforts. I would say there's more information every day, so we shouldn't be in panic, but we should be very informed and prepared. And I think at UW Medicine we've been doing that. And we're constantly adjusting to the new information. One other piece of advice is to not let fear paralyze you. I think your best friend almost in anything is really information and really having the right source of information. We know that there's a lot of misinformation, and we also know that there's a lot of unnecessary stigma around certain populations, and I would caution folks and remind them that infections don't have a predilection. They can affect all of us, and we're all equally at risk. So let's not judge, and let's all unite and be healthy and safe.